The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Ciarra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I have a special guest with me, Paula Yost. She is a seasoned attorney and mental health clinician who brings a multidimensional perspective that blends legal precision with human compassion. Oh, we're missing so much of that in the world right now. She is deeply committed to what she calls legal social work, advocating for individuals at the intersection of law and mental health. So I am so happy to have you here today. Thank you for joining me.
Thank you, Ciarra. Thank you for having me.
Yeah, we're going to talk about advocacy today. And this is something that is so huge when people think of, like, I'm a birth doula. And so when people first come to me searching for a birth doula, they're always like, oh, so many of them, I need somebody to advocate for me. And so we're going to talk today about learning to advocate for yourself and your child, because when people are pregnant, that's what comes next, is having to advocate for your kiddo. So can you first start off by talking to me a little bit about what is advocacy? How would you define that or explain it?
I think the simplest way to explain that to the average person is it is the ability to stand up for yourself without shame or guilt and to feel confident in being able to ask for the things that you want and that you need.
Yes. And isn't it funny that it's so hard for so many of us, even like the most well-educated and the whatever, like so many of us have a hard time doing this. And I often tell parents, advocating for yourself during pregnancy and your birth is a trial run for advocating for your kids later on. This is just like your intro into parenting.
That's correct. It does not get better. I think so many women have been conditioned to be people pleasers, and to not rock the boat. And, there's just times in life where you have to.
Mm-hmm. And we want people to like us.
Yes. And your pregnancy is one of those times where you have to be able to advocate for yourself. So many women have fears or sexual trauma or whatever that makes the process of giving birth scary. And it's not always the actual birth itself. It's the emotion that is associated with that. And we just need to be able to have the space and the freedom to ask for what we need.
Yeah, absolutely. And that evolves throughout different stages of life, right? So even before we get pregnant, we do it. We do it a lot when we get pregnant and we're through that pregnancy and birth situation. And then as our babies are born and they grow. So what are some common situations where I think a lot of people know during pregnancy kind of where they end up advocating for themselves, but where do you think that people really advocate for their child within a medical setting? What are some of those different situations that they might need to do that for?
So I see it in a multitude of them. One of them would be, I have one child who was born with a complete bilateral cleft lip and palate. So he was born without a roof in his mouth and half of his nose was missing. Wow. Thank God I live right outside of Charlotte, North Carolina, and my husband is actually a certified registered nurse anesthetist. So my husband, again, thankfully, has tremendous medical experience. There's very few surgeries that my husband hasn't observed and done anesthesia for. So we were fortunate in the sense that there is an internationally famous craniofacial plastic surgeon named Dr. David Matthews, who lives right next door, in town right next door. But for so many children with cleft palate, they have to travel to a big city. Their local pediatrician has never seen this condition before. They have no idea what to do, or they tell the mom something that just doesn't make sense. And one of the things that I did, I found out that Prattley had cleft palate when I was 16 weeks pregnant. My obstetrician asked me if I wanted to do some genetic markers during my pregnancy, and I consented to that because I just thought if there's something there, I want to be the best mom I can be for my little person. So if there's something there, I want to know.
Study
And
up on it. Whatever it is,
study up.
study up on it.
Study up. Advocating is also studying up. Advocating is also arming yourself with knowledge and reading. And so I had a genetic marker that came back abnormally. She called me while I was literally out of Barnes and Noble, bless her, and said, "Hey, I'm sending you to maternal fetal medicine right now. I want you to get in your car and go get a high def scan," because I think they thought it was something worse than what it was. And I went in, I had an amniocentesis. It was a lot. It was a lot. But after that, I spent months, like the rest of my pregnancy, studying what kind of bottle does this baby need. I did an early consult with Dr. Matthews. I read over 600 medical journals. So when my baby was born, I knew. Like, I went to the hospital with bottles. I didn't rely on the nursing staff at the hospital to be able to have those things. And I'm thankful that I didn't, because they didn't have anything that would have helped my little boy. Like, I'm convinced that if I hadn't shown up at that hospital with the bottle that he needed, he would have wound up being labeled as failure to thrive. And I would have wound up having to have him get a Mickey button. And I don't think that would have been necessary, because I did the work on the front end. And sometimes moms can't do that because they don't know, or because something unexpectedly horrible happens. So my second child, I had acute preeclampsia. And so I wound up in the hospital with stroke level blood pressure, and I delivered my second baby at 27 weeks gestation.
Wow.
So I didn't know a 1 pound, 14 ounce baby could live. I mean, I wasn't even showing when I delivered Pearson. I wasn't even out of my second trimester.
I just had a baby at 26 weeks with a client, and she was less than the first percentile. So when she was born, she was 1 pound, 2 ounces.
Yes.
Wild. It's absolutely amazing what modern medicine can do.
Amazing. And like, thank you, March of Dimes, right? And like, thank you, Preeclampsia Foundation. No one is going to be able to prepare a mother for a traumatic birth and an emergency pregnancy. And when it happens, you kind of have to figure out how to feel confident saying what you need. Like,
it's a sink or swim moment.
Yeah, it's a sink or swim moment. And you also have to feel confident being able to communicate what you need to medical professionals. I think there was one time, I can think of two instances where I was not very kind. And in retrospect, I am okay with that. One of them was when Prattley was born. So Prattley's my cleft palate baby.
And so how long ago was this?
Prattley is now 12. And he is thriving and he's doing great. But when he was born, I was kind of recovering from the birth. Like, I was in the labor and delivery, like the aftercare area. And I heard this nurse say to another nurse, "Does she know?" And I screamed, "Yes, she knows. She's known for 16 weeks.
She knows." Although you just talked about yourself in third person right along with them.
I did. I was like, "Yes, she knows." Right. "Yes, I know my baby has a cleft palate. Give him to me and please get away from him." Right. Yeah. Same baby. When he was 4, Prattley's had about 6 corrective surgeries and an unprecedented amount of orthodontia work. But when he was 4, he had to have a surgical procedure to basically build bone structure in the roof of his mouth, because he didn't have that. There was nothing there for him to grow teeth. So he had to have bone taken out of his hip, mixed with cadaver bone and stem cells, and have them implanted into the roof of his mouth. So I was, at the time of this surgery, I had a 2-year-old at home. So Prattley's 4, almost 5. My 2-year-old is at home. And I am currently pregnant with baby number 3, who was an accident. Baby number 3 was unprecedented and unplanned. Right. So I have a lot happening. Right. And I'm also working full time. Let's also add that.
Oh, of course you are. The moms do it all, don't we?
Of course I am. So I'm at the hospital. My son's through surgery. He's up in his room. He's settled in. And my husband, who again is a certified registered nurse anesthetist, looks at me and he goes, I want you to go home. I have this under control. You go home, take care of Pearson, and get a good night's rest in the house because we need to protect your health and baby number 3. And I said, thank you. I love you. I am leaving. And I picked up my purse and my keys and walked down the hall, where I was promptly stopped by a very young nurse who said, where are you going? And I said, I'm going home. You can't go home. I said, my baby's with his dad. Like he's in the room with his father. He's fine. And his father's a master's level nurse. Like he's got more education than you do. He's okay in there with his dad. But your mommy.
Oh, no.
And I let that young lady have it. And I'm proud that I did. Because
she should never have even opened her mouth.
Because quite frankly, what judgment? Like I was not showing at the time, so she wouldn't have known I was pregnant. She wouldn't have exactly, it doesn't matter. She wouldn't have known that I had a 2-year-old at my home who also needed me. You know, what about
matter? Because what about just you? What about even just you as a human?
And also that, I mean, I could see it if I had walked off and left my child with, unattended.
Nobody. Mm-hmm.
I get that. But he was with his dad. Between the two of us, his dad is way more competent to handle a medical emergency. That's one of the reasons I married him in the first place.
Right.
Like, he's with his father, who's more competent than half the people in this hospital.
Do you know, I see this all the time. Actually, there is a hospital here locally where if a mother has a C-section, let's say I'm in the room with the mom with the C-section and the dad's right there too. And this is a situation, this exact one. The dad left the room when they brought baby out of the room. And they were taking baby over to nursery to do the measurements and weight and things because they didn't have it in that C-section room. It was real small. And I'm with mom. And I text dad and I was like, hey, are you guys settled into the room? And he goes, no, I'm sitting in the room. They wouldn't let me take the baby from nursery because they said they don't have a nurse to wait with me in the room. And I said, but why is something wrong with the baby that the baby needs a nurse? And he goes, no, but they said that if the mom's not in the room, they can't leave me with the baby. Wait, so you're saying that the other parent, the 50% parent or 100% parent, isn't allowed to be in the room with his own baby unless somebody's watching him? This is like the mentality that only moms can do it, which further makes it so that us moms feel so overwhelmed because we're the default parent, and that's not fair.
That's exactly
not fair to dads.
It's not fair to dads. And, I can understand some of that if you've got a history of domestic violence or if mom is saying I'm unsafe.
Yes.
But the reality is that is probably not the majority of us. Most of us want the father to be involved. It's the same thing, too, with like pediatric appointments and school visits. Like I finally had to say, please call my husband, like text my husband, like I am actually married. I have to advocate for my husband and say he is an involved father and a very, very good one. Like you do not have to call me. He also knows what's going on. He doesn't. And that is how it should be. Like women are exhausted because we have to do everything and we should not have to. We did not make these humans by ourselves.
Mm-hmm. And this is exactly it. So, when I asked you that, what other situations may we have to do this with for our child? You had 2 very extreme situations. And then I gave one that's so dang simple as a dad getting to sit in a room by himself with his own child with nobody else there. Or something as simple as, even in pregnancy, not wanting to get induced or getting induced when it's not medically necessary, but they'd like you to, your doctor's going out of town, something so small. Or you don't want your baby shot at this appointment, you want it at the next appointment. Or they're saying that your baby's teetering on the edge of failure to thrive, but they're right there. Do you want a supplement or do you want to keep on trucking? Because you're right on that line where you could just keep nursing without supplementation and it wouldn't be neglectful, Or would it be more peace of mind for you if you did add that formula bottle in there? There's just these things that are so not big deals. And then some of them are a big deal, but you don't know before you have a baby if you're going to have those big ones or if it's just going to be a bunch of those little small ones. So, Why do you think, because you did such a great job of it, you're like, excuse me, call my husband. This is ridiculous. But why do you think that so many people struggle to do this for themselves and their children, even if they just know something is not right?
I think a lot of it is they are uncomfortable with confrontation. They are used to being people pleasers. And also because, unfortunately, if we do advocate for ourselves, we get pushback. And then the pushback feels uncomfortable. And then we feel like, well, am I doing something wrong? Am I overreacting? You know, like when that nurse got in my face about, well, your mom, you can't leave. Like, I felt like trash when I walked away from that conversation.
Like you failed.
Yes. And I felt like, oh, I actually called my husband, I called my husband very upset later that day. Like, I didn't call him immediately because I knew he was busy taking care of my 4-year-old. But I did call him later and I was like, do you think I'm a bad mother because I left? And he was like, what are you talking about? You're pregnant and you went home to take care of our other child. Like, why would you even think that? And I was like, because this nurse said. And he was like, that's just a bunch of crazy. And he was like, and as a medical professional, she should not have said that to you. She should have kept her mouth shut.
And what about if the dad isn't there? Is the dad a bad dad? Or is he a good dad because he's home taking care of the other kids?
Nobody's asking that question.
No, they're not.
No one is asking that question at all. They're not.
Let me go backward for a second too, because this is way more than just medical situations. So what are some other things as a parent where you're like, okay, outside of the medical field, what are some other things that parents end up needing to advocate for their kids about that maybe they haven't thought about yet?
Oh, let us talk about speech therapy. So my cleft palate baby, understandably, had a difficult time with speech when he was a little guy. Like, I can understand him, but I'm his mother. Moms always can understand our kids. You know, that doesn't mean your kid doesn't have a raging speech impediment. You just know what your kid needs. You just know what your
their
kid,
language.
Right. You're used to what he points at and his mannerisms. You know what he needs. But the average person is like, I have no idea what your child is saying. You know, Pratley's issues were exacerbated by the fact that I'm not ashamed to say this is a fact, he is academically gifted. He did very well on IQ testing from the time he was 4. So 3 and 4, he could name like 52 dinosaurs. So I take him in for a speech therapy evaluation with the public school because clearly he needs speech therapy. He doesn't have a roof in his mouth. Well, he did at that point, but his velum was not properly developed. He also had braces at the age of 3.
Wow.
Things in his mouth were, he's had braces since he was 3 years old. Things in his mouth were moving. Like the problems you deal with as a teenage parent, I've been dealing with it since my little guy was 3 years old.
With a toddler mentality. Like, correct. It's hard enough to get a teenager to do stuff with braces in their mouth, let alone a 3-year-old.
Correct. We've been through headgear that looks like a medieval torture device. Like we've done a lot. And I go into a speech therapy evaluation and was told he doesn't need the level of speech therapy that his craniofacial plastic surgeon, you know, that guy I told you about earlier, that's kind of a big deal and internationally famous. We don't need to follow his recommendations because this child is too smart. And if he knows the names of 40 dinosaurs, he really doesn't need that much therapy. And I'm like, okay, being smart has nothing to do with the fact that you cannot enunciate your letters. Also, there are so many, again, academic and medical journals about cleft palate children and how they struggle with reading. They struggle with early literacy because their hearing and their ability to see language is different. That is why you need speech therapy. It doesn't matter how smart he is. He literally has a medical condition that impacts his ability to learn. And further, he wound up becoming a COVID kindergartner, which definitely didn't help anything because then when he does go back to school, first grade isn't a mask for him. Mm-hmm. And so you can't really learn a whole lot about speech when your educator's face is covered by a mask.
See their lips.
Right. You cannot see their lips. So I wound up in a whole full-blown litigation about this. That was a good time in my life. But IEP meetings, I prep parents for IEP meetings.
Can you tell people what that stands for?
Yes. So an IEP meeting is an individualized educational plan. So essentially, if you have a child with any kind of special need, blind, deaf, cleft palate, autism, low IQ, ADHD, any kind of diagnosable issue that impacts your ability to learn. You are
Dyslexia,
dysgraphia, all of it. There's a huge list of things that could qualify you for an IEP, but these are people, they're children who need some additional educational assistance and guidance. And so my son's was just never adequate. And so, that was one of the steps. We had to do a lot of fighting and arguing to get him the basic therapies that he needed. And one of the things I find so incredibly frustrating about this, I really want human beings to be able to shift their mind to an understanding that things like occupational therapy, physical therapy, speech therapy, if you give these to children when they are 0 to 5, you eliminate the need for these things when they are older in many cases, because early intervention is critical. If you get them what they need, it's just like with dyslexia and dysgraphia. The earlier you treat that, the earlier you provide these children with care and services, you're not then dealing with problems like this when they're 14 and 15 years old. And then it's an ingrained habit, and it's much more expensive and difficult to correct. And it becomes a lifelong problem.
I think people don't see it that way when it has to do with the mind and when it has to do with things like this. Now, if you think about it in terms of if you starved a child and didn't give them enough nutrition, then of course their bones would start off at a deficit and then they would have problems later on down the line. People get that like actual physical nutrition makes a big difference, down the line far. But when it's so many of the things, because some of these are mental and physical combined, but the understanding, the cognitive processing, those sorts of things, I find it's the same with mental health versus if somebody has diabetes. You'd never be like, oh, let's not give them insulin, but you're like,
Right.
maybe let's not do therapy and medication for a person this age. It's just this stigma.
It is. And it is not a helpful one. And in fact, it is harmful.
Yeah.
I think another thing that I hear a lot is, well, they'll grow out of it. Like, all kids do that. They'll grow out of it. They might not. In fact, many of them don't. And even if your child does grow out of it, that's great. But you don't have a magic ball. You can't foretell the future. What actually might happen is your child might have a major health issue that goes uncared for. And especially with speech, that impacts literacy. I live in North Carolina, where we are at the lower level of education right now nationally, which is a disgrace, honestly. But I was looking at the reading proficiency levels for my local public high school where my children would go. It is 57%. And I'm like, when your literacy rating... Thank you. How? There are third world countries that have 100% literacy ratings among adults. Like, when you have a 57% reading proficiency rate, that is what is impacting our children's mental health. I mean, there's a lot of things impacting their mental health. I'm not trying to discredit social media and all the other problems that these children face. They're growing up in a very different world than we did because of the internet. But when you feel like you can't read and every day at school is a struggle because you don't understand what you're doing, you're going to feel like you are stupid. And if you feel like you are stupid, you are going to get depressed and anxious. And you're also
going to fill that with other things. And Correct. It's not a failure of the child. That is a failure of the system. That is a failure. I always tell my daughter, I don't care. I have an almost 16-year-old and an 8-year-old. By the time this comes out, she'll be 16. And I always tell my daughter from the start, when she had those STAR tests, that's what we have in Texas. That's like our standardized testing. I always told her, I don't care what you get on those tests. I don't need you to study extra for it. I want you to do exactly what you always do and not worry your pretty little head about it, because it is not an assessment of how smart you are. It's how much the system did to prepare you for this test. Like, that's really it. It means nothing on your abilities.
No, and we don't care. Exactly.
I don't care.
And you just also perfectly described too, like being able to have some discernment, like being able to discern like what truly does matter and what does not truly matter. Like our children, and by our children, I mean like the children of the world, like our children being able to read, to write, to be able to speak clearly and efficiently, to communicate what they need, to have emotional maturity. These things are all important if we want to have a better society. We are doing ourselves no favors. Like you're going to have to spend money on humanity one way or the other. You can spend it on early intervention just as easily as you can spend it on prison.
And rehab.
Absolutely.
Yep. Yeah, because that's where we end up when we have people that feel like they don't fit in with other people because they're not understood, or they can't communicate, or they can't just function in everyday society, So
Right.
this is so helpful, because I think that parents don't realize how many times they may be advocating later on down the road. And we just talked about how, like, this is really hard for some people, even when they know that's the right thing to do. So do you have any like practical tools or strategies that parents can use to prepare for these appointments or meetings where advocacy may be needed, whether it's with a provider or whether it's with a school?
I do actually. Some of the things that I like to tell people, at least if I take the school and the pediatric appointments differently, right? So if you're going to a pediatric appointment, you are dealing with a professional. I mean, your doctor hopefully is a competent person. That's why you're taking your child to see them. So if you have a concern or if you have something you need to talk to them about, I would just encourage you to try to be as professional as possible. If they don't agree with you, ask them why. Ask them to, explain to you why they feel that way. If they say something that you're like, well, okay, I hear what you're saying, but that's not in alignment with what I'm seeing in my house, communicate that. Do not be afraid to communicate. Just remember, like, don't ask, don't get. Don't speak up, don't get. Like, you have to be able to advocate. Most of the time that goes better than people think it does. People are so structured for like pushback and they fear that confrontation. It's not being confrontational to have an educational and knowledge seeking conversation.
And
If
confrontation doesn't have to be rude.
it does not.
Some people, even the smallest level of pushback, even if it's polite, they're like, eek, but
Right.
that is an effective way of communicating.
It is.
Direct
And it
communication.
is. And it is okay. That is nothing to be ashamed of. If you cannot advocate for your children, you are probably not doing your top job as a mom. There's nothing more important than being able to advocate for your kids and ask for what they need. That is your whole job.
Mm-hmm.
And so I will also add, if you go to an appointment with a pediatrician or with some kind of child specialist and you do not like what they have to say, or you do not agree with what they have to say, get an appointment with someone else. Go to a different practice. Ask questions. Just because somebody told you something that doesn't seem right to you or you don't agree with it, go see someone else. Get a second opinion, because you don't need to be sitting there thinking, I'm worried that my child is neurodivergent. And the doctor saying, after I saw your kid for 15 minutes, no, your kid's fine. And then you're still worried about that and you're carrying that around for 2 years. And then in 2 years, you find out you're right, because the symptoms that you've been saying, I'm seeing this for 2 years, are now more profound. Especially with also things like autism or dysgraphia and dyslexia. If you're not getting what you need from the pediatrician, find an educational-based psychologist. Most large communities, most cities have some form of an educational-based psychologist. You might need to go travel. You might need to spend 2 nights in a hotel. And I understand the expense of that sucks, and no one wants to spend money on that. But if you go do something like that and someone gives you legitimate, educated, spot-on evaluation following a 4 to 6 hour meeting with your child, as opposed to seeing them for 20 minutes, then you're going to feel confident, and it's probably going to save you a tremendous amount of money if you fix a problem at age 4 instead of fixing a problem at age 6. It's going to be easier. So the investment is going to pay off in cost benefit. What I also talk to parents about with the school is a different situation. Because what most parents report when they go into a special education meeting at the school is mom, sometimes dad, mom, hopefully dad. Mom and dad walk into a room and there's 12 people there and them. And then if they start pushing back or saying, I don't agree with that, or I don't see that, or I want this, or my child needs this, there's a whole gang of people there arguing with them. That can be a much more intimidating and scary scenario than just being one-on-one with your physician.
Mhm.
And so, as a result of that, I usually tell moms and dads, do not ever, ever go to an IEP meeting by yourself. That does not mean you need to have a lawyer. People call me all the time and they're like, can you represent me in my IEP meeting? No, because if you bring a lawyer to an IEP meeting, the school system is not going to want to meet with you until they're able to have their own lawyer there. And then scheduling two lawyers to have your kid's IEP meeting is going to take months. And the person who's losing is your kid. So
Yes.
we're not going to do that. What you're going to do is look to see if your community has an advocate. There are advocacy groups popping up all over the country. And these people are awesome because what I discover with many of them is they are either retired teachers who know exactly how to take care of special education children and who have a legitimate heart for this, or they are mothers who have done this for 18 years and their kids are grown now, and now they're seeing other mothers get treated the way they used to get treated, and they're here to be your advocate. Many of those advocacy groups are nonprofits, and you can get somebody to go with you for free. So, always, as mom and dad, you are always legally entitled to bring an advocate to your IEP. Don't go alone.
Yeah. And if they are feeling like, we talked a little bit about, some tools there. When their emotions are really high, when that happens and they're like so triggered or so frustrated, what are some ways that parents can speak up without shutting down if they find themselves needing to advocate, but they're like, I am not being listened to or taken seriously? Getting an advocate like that, but like, what if they're in that situation? Do you have, like, they already didn't get one and they're needing to maybe reframe something, or they're like, okay, I already got past the point. I wish I had your advice already, Paula, but I didn't when I went in. In that moment, is it like telling them, hey, I need to reschedule this? Like, hold on, I don't think that we're
So,
getting far here. I think that we
yeah.
need to pull back for a second.
So, a few things. The first thing I would tell you to do is, excuse me, I need to use the restroom.
Perfect.
Anybody can use the bathroom. It's just like being in school. Teachers are used to kids asking to go pee all the time. Excuse me, I need to go to the restroom. Go to the restroom, take 5 minutes, go in there, lock yourself in a stall, see if you can get yourself together, lower your blood
Regroup.
pressure, breathe a little bit, think, what do I need to say? Right? And go back in there and try again.
And bring notes. I say write them down. Or even if that happens, like, get on your phone in your notes app, when you're in that moment, in that 5 minutes of regroup, so that you can have, some tick off things to go, okay, I want to make sure I think about this. Because in the moment, you forget all the stuff that you're going to say.
And also, don't ever forget, you're always able to try again. This is supposed to be about the best interests of our children and what is best for them. So if you walk out of that IEP meeting and later that night and that week you are like, I am unsatisfied, this is not working, you are always able to ask for another meeting. Always. They cannot deny you the right to have a follow-up meeting. You can schedule another one. You can take the advocate to that one. You can always do it again. If you're not happy, you can always continue and have no shame or blame in that. It might be hard to send that email. You make it a 2-sentence email. I feel that there is issues with my IEP and I would like to request a second meeting. I'm available at the following times. You don't get into a bunch of detail. I want this and this. Short, this is what we're doing.
Yes.
Because they're not able to tell you no.
Right. They have to let you, like, that is your right. You do have the right to have those meetings.
Correct.
I find that when people are pregnant, we often, and not always, because some people think something's wrong and they're not listened to. But I find that actually the majority of what happens is people are being told something is wrong when they're like, no, it's not. Or like, that is such a provider preference over medical necessity. I see this very often where intervention is being said that it's needed, but really it's just the provider wants to intervene for convenience. And yes, of course, again, I want to give space that some people are like, I have preeclampsia and they won't even test them for it, right? And they're like, no, you're fine. But then once our babies are born, when we know something's wrong, that's when we get shut. Like, I think that's when we're told, no, everything's fine. Everything's fine. Everything's fine about our babies. And like our intuition is wrong, or we don't know. And we know. I joke that moms, after the first 2 things that we get right on what our baby's diagnosed with, we should get our own prescription pad. Because I'm like, I know when my kid has an ear infection. I know when my kid has pink eye or whatever.
Right. We know mothers truly do know.
We know.
Mothers do know. Yeah, it's frustrating. And there again, like I also want to add too, I am not saying that this is easy at
No.
all. Like in full candor, I have 4 law licenses. Like I am not a wilting flower of a woman. Like I mean, I'm not. I think the most upset I've ever been in my whole life was after I left an IEP meeting for Proudly. I left there angry, frustrated. I pulled over into a CVS parking lot and cried so hard that I vomited into a coffee cup. First of all, absolutely no woman anywhere in America should feel that way about her child's welfare. And the people who made me feel that way, they have a problem. I don't know why they're educators. You should not make a mother feel that way about anything. So, first of all, there was that. But second of all, what made me angry is I have the resources and the knowledge to sue and get what I want one way or the other. What is happening to all of these mothers and children who do not have that ability or that knowledge? And that is where we are failing as a society. We truly do need to all be focused on what is in the best interest of our children and our humanity. And we fail. We just fail. Mm-hmm. And I find that overall to be very frustrating. And that's one of the reasons I wrote my book and just wrote my whole story out. I in full candor, I wrote it because I'm angry. I'm tired of seeing this happen to people over and over again. So I say all that to say, if you are the mother who is sobbing and puking into a coffee mug in a CVS parking lot, I have done that too. You are not alone. I see you. And be really, really nice to yourself. Take a night to just go home and try to veg out and relax and call upon your support people. And if you don't have any support people, get yourself some. Mm-hmm. Almost every community has a mother or a retired educator who has done this before and who can help you, or a birth doula who can help you. There will be somebody who you can create your own community. You just have to search for it.
Yeah, ask around. I always tell people I might not be able to help you, but I probably know who can. You know,
exactly.
Like I'm just a catalyst to help push off to other people and recommend to other resources sometimes, because I'm going to stay in my lane, but I'm going to help you find what you need. And then that person might not be it, but they might be able to help you find what you need. You just got to find those people and hop around to them. And should we have to do that? No, but that is the reality of what we're dealing with. So right. I love that you mentioned that you wrote a book because of this. Would you mind sharing what that's called and how people can find it? And I'll share this in the show notes as well, or how they can find you in general.
Sure. My book is called Tumbleweeds, and it's available on Amazon. And so you can go on there and order it. But essentially, it is a very personal book. And like when I wrote it, I was even like, oh my gosh, do I really want the world?
That's vulnerable.
The world to know all of these details. I mean, I talked about conception. I talked about preeclampsia. I talked about, my husband's boss walking by my head. Literally, my husband's boss was present at my C-section. Oh. I think about 50 people were in the room when I gave birth to baby number 2. And I was very sick and, all these personal scenarios that I write about in my book. And I was like, do I really want people to read this? And I just sort of gave that to the universe. I'm like, I hope that what I write about helps people. I really do, because I don't want other mothers and people who are doing the best that they can. I don't want them to get beat down by some of the stuff that beat me down or that almost beat me down. And I really want to help people feel like they're not alone and to have some semblance of hope. And that's what I'm hoping my book does for folks.
I love that. Do you have a website or an Instagram handle or anything you want to share here?
My Instagram handle is Paula J. Yost Author, and my Facebook page is also Paula J. Yost Author. And I have a whole bunch of videos up right now where I talk about all kinds of parenting and child welfare things.
Awesome. Thank you so much. This was so valuable. And again, advocacy is one of the things that I hear that word the most, probably. So I think it's so important that people realize that doesn't end when the baby's born. It's just beginning.
That's exactly right.
Thank you so much.
Thank you, Ciarra.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.